In our last video, we discussed a recent study that concluded that 34% of patients seeking naturopathic treatments refused chemotherapy, compared to only 3% of patients receiving conventional care. This week, we spoke to Dr. David Palma, founder of QualityCancerTreatment.com and radiation oncologist at the London Health Sciences Centre. We talked to him about some of the truths regarding naturopathic treatments, as well as conventional care. So we asked him, what are some common misconceptions regarding cancer treatment and cure?
One of the most common misconceptions that I see is that chemotherapy is not beneficial, and that is completely false. Lumped in with chemotherapy, we have other types of drugs like immune therapy, we have targeted therapies. These work very, very well for treating cancer, and we have large studies that show that they can improve survival and sometimes cure. But then you get situations where people online are saying, well, chemotherapy never helps people. It ultimately makes the cancer worse no matter what, and that's totally not true.
There's been plenty of research conducted over the years regarding the influence of a person's dietary habits on their risk of cancer. A lot of this research suggests that eating healthy diets filled with lots of fruits and fiber can decrease cancer risk, while eating processed and red meat and salt-preserved foods can increase the risk of certain cancers. Links to these research papers can be found in the description below. However, what effect does changing your diet to lower sugar intake, say something like a keto diet, have on the growth of tumors for patients who already have cancer?
It would be nice if it was very easy with something like diet to slow down your cancer, but the studies have not borne that out. So we like to think that if you have cancer and you eat healthy, it's going to stop the growth of your cancer. But the truth is that a cancer can grow pretty much no matter what. These are cells that have gone rogue that will just divide, and you need something quite toxic and quite directed at them and quite well thought out, like a well thought out drug to really stop them. So just by changing your diet, lowering your intake of sugar, those interventions have not shown to be helpful. The only little bit of evidence we have is for some of the cancers that are driven by hormones like breast cancer and prostate cancer. There's a little bit of evidence from randomized trials that if you change your diet in certain ways, you can have a small impact on the chances of cure. But for the most part, dietary interventions don't work.
We spoke to Dr. Palma about the pros and cons of naturopathic treatments for cancer, as well as about integrative oncology as a whole. Tune in to #NaturalCancerCures on the #Health Podcast to hear the full story.